We are back answering your Medicare, Medicaid, and ACA questions. Steve, this person says, can you explain what the donut hole is?
Yes. So with your drug coverage, and this applies to both Medicare Advantage plans and standalone prescription drug plans, you have three different categories in your prescription drugs. You have your initial coverage phase. That's when your drugs are running in the neighborhood of from $0 to $5,030. As long as you're in that phase, you're just simply paying a copay. At $5,030, you go into what we call the donut hole. When this happens, you're required to pay more copay. And it's usually a percentage, like 25% of the cost of the drug. And then you stay in that donut hole phase until your total cost of drugs reach $8,000, and then you're in a catastrophic phase. And then the coverage becomes quite good. Then your copays drop back to very little. So there's three phases of them, and those numbers that I just gave are for 2024.
Okay, gotcha.
Yeah.
All right, Laura, this person says, with the Medicaid expansion, do assets such as savings accounts affect eligibility, or is it strictly income only?
I believe it is income based, and like I mentioned before, you may have qualifications that change your eligibility, such as disabilities or other things.
All right, and this question, Catherine, if I have a VA disability rating and I get all my medical services through the VA, do I still need Medicare when I turn 65?
You do. You do, and Medicare and VA work together on billing and providing for your services, so you must still sign up for Medicare.
Okay, this person has an ACA plan and their baby is due in December. Should they wait until after the baby is born, or should they re-enroll now with a new plan?
Well, right now you're enrolling for next year's coverage, so you can go ahead and do that because your deductible will reset anyway, but you would not want to change your insurance right now, since when you do that, your deductible resets.
Okay, gotcha. This person wants to know, oh goodness, we've got lots of these questions really quickly. If I have a spouse who covers me on their insurance, do I have to enroll in Medicare?
Yes. Yes, there's no circumstance under which when you turn 65 that you don't enroll.
Okay, and can a person who just started getting SSD get Medicare at age 59?
Normally, when you are on Social Security disability, you are also enrolled in Medicare at the same time. So if you haven't been, you need to check with your Social Security disability program to see what's going on with that.
All right, we've got 1 minute. Steve, this person wants to know, why are the benefits or services so different depending on where you live?
Because of networks. The network that you're in, like in this area, you could have Cone Health, you could have Wake Forest Baptist, which is now Atrium, you could have Novant. But all these different health providers, they have different contracts with the insurance companies. So, you know, the plan can vary a lot just because of that, because of the network.
That's why they say you need to put in your zip code and see if this plan is available where you're at. I understand.
Right.
Okay. Thank you all for your help and your expertise. We've got lots more on this. We want to make sure you have the resources and the links that you need. It's going to be in the Who Wants to Know section.